I would like to speak today about VELES Excellence Hub, and I would go quickly fast because we have another presenter. So as my colleague Julian mentioned before, the International Data Space Association is involved in many different projects, including Horizon project. And this is the project that I'm going to present. This is the Horizon project. So in this project, IDSA is leading two tasks. Basically, we are building the framework which would allow countries to build the data space and share the data between data owner, data consumer, or data provider and data consumer. And we are leading the task of stakeholder engagement. That's why probably you know I come to many people today and ask them to share their knowledge with me and invite them to present their use cases. So as you see, this project is 2 years. It's just recently started in 2023. It's going to take 48 months. Basically, this is the initiative regarding to the Greece, Bulgaria, Romania, and Cyprus, all those 4 countries lagging behind the European Union regulation and policies, but until 2025, they have the main aim to build the European data space and to be involved in European data space. So there are 2 main goals. First, this is national data space, and in 2025, they are planning to build an international data space. They are planning to share the data in 4 different pilots I would mention a bit later. So this project is presented by consortium. There are 15 consortium partners in 7 different European countries. And as you see, International Data Space, one of the members of consortium. This project basically behind of Bulgaria, Cyprus, Romania, and Greece, as I mentioned before. And this digitalization cross-sectoral healthcare project, which is built based on VELES Excellence Hub. VELES Excellence Hub presented by Bulgaria, a Ministry of Digitalization and Health and Innovations in Bulgaria. Also, the government of Romania, Cyprus, and Greece are involved in those projects. So this project, as I mentioned before, would take the 4 years, and all participants and members from 7 different European countries are highly motivated in this project, in the sharing and building the data and policies and regulations. As you can see on the map, there are different colors, and in the square you can see those countries that basically are working on building the data space. From the challenges I mentioned before, that there is no policies, there is no regulation, there is highly motivated people who are going to exchange the data in the 4 different pilots that I would explain better in a minute. The vision of this Excellence Hub and European Health Data Space is basically promoted by European Union. This is 5 million project, the main budget of this project. This project is supported by United Kingdom, Sweden, and Germany. Basically, all those 3 countries will share their experience and help Bulgaria, Romania, Cyprus, and Greece to build data spaces. As my colleague mentioned before, data space, this is a space of the trust, where the members or participants of the data space sharing the data based on policies, protocols, and based on IDSA reference architecture model. So this is infrastructure. The version of this infrastructure is 4.0, so maybe you would have time to have a look later. It's quite interesting. As you see, this project has 4 different pilots: Bulgaria, Cyprus, Greece, and Romania, presented by Alzheimer, dementia, cancer treatment, and cerebral tumors. Those members of consortium mentioned basically, and they present the knowledge and institutions in these pilots. From the pilot's objectives, I would specify the architecture and technologies they are planning to build as based on IDSA reference architecture model. They are planning to make the research, lots of institutions involved in these projects, not only research institutions, also clinics, hospitals, and founded stakeholders who are highly motivated to make the research and build the ecosystems in those 4 countries. The pilot goals basically build on the smart objects, cloud platforms, data of citizenships. That's also my colleague mentioned before. So in the center, there's citizenships and their needs in their data. So the question of regulation of privacy of the data is one of the most important questions in those projects in the data space itself. Who are stakeholders in this project? Basically, we are speaking about personal data, which is quite sensitive data in data spaces and in sharing the data. So there are patients, public hospitals, private clinics, policymakers, government institutions, academia researchers, and media, and so on and so forth. Overall concept of this project basically been built in this circle, as you can see on the picture, and based on the IDSA reference architecture model, you would see some components. As my colleague Julian mentioned before, IDS have some components, and these basically components are helping to provide the data and consume the data based on policies. IDSA, as the company non-profit organization, certified those components, and that means this data is shared in secured way, and all the policies, all the members who share and consume the data, they're under the regulation of those policies. The project impact basically based on the regional smart health data space, and this regional smart health data space is going to be the part of the European health data space, which are planning to be built until 2025, 2027. So you can see on the European Union platform the plan of the building this health data space itself. The expected results basically from the project that they're planning to be built 4 different ecosystems. Health digitalization in the center, and the private data is the high question in this project. I would not go into details because we have a bit lack of time. So as you can see, this smart health data space is built on the IDS reference architecture model. Today we had lots of speakers, and all of them presented the platforms. Yeah, all of them spoke about difficulties, challenges that they faced during the building platforms, integrations, consuming and sharing the data. But basically, none of them spoke about governments and policies and the way how they build those platforms technologically. Because the main question that I got today in the depression, so what is the regulation of sharing and consuming the data? Yeah, if everyone can access this platform, so what is the privacy in this data? Yeah, if everyone has access to my personal data, how I can control this and how I can stop it? That means not only me as a participant, as the member of the hospital can access to my personal data, and also different third parties have access to my data, which I cannot stop and control itself. That's very important to speak about trust here, because policies and trust based on a reference architecture model presented by IDSA is the main question here. And component they're helping to consume and share the data, they're under certification, and that means they're under the regulation between those members who are part of data spaces. So I would say this from the technical perspective, we would speak here about reference architecture model of IDSA. From the regulatory perspective, we would speak about European Council regulation, and from the ecosystem perspective, as you can see, basically the main goal, the main path is going to European Union data space. I would not stop saying about governance principles and details, because I just spoke about it in a few minutes before that. I would say that providing the rules, make the research about European experience, and building the ecosystem in the countries such as Bulgaria, Romania, Cyprus, and Greece. Currently, very important questions in this project. And I'm really happy to be a part of this project because I see not only government involved, not only third parties involved, funded organizations, also doctors who are working with the patients and who are highly motivated to improve this process. Thank you very much for listening my presentation. Here you can contact me.